You'll get a sticker. All right, socks and shoes, sir.
What's that?
Who's got my checklist? Brittany, thank you. So you're going to introduce yourself to the patient. My name is Jamie Count, physician assistant here at Gardner Webb University. Come in to do a neurological examination day. Is that correct? Yes. Can I get your name and date of birth?
Zane Hodgkin, 11/14/1999.
Born 14 days apart. So while I'm getting your hands washed, blah blah blah, do you mind taking off your top, your bottoms, and get your shoes and socks so I can get exposure to your body? So I will wash my hands for 30 seconds, carry on casual conversation, make sure the lighting is good in the room because that's important, and then I will start my exam. And so I think at the very first, Brittany, we are supposed to say something about, I would first make sure I did basically a behavioral assessment or a mental status exam. Since we've already covered that earlier in the semester, we're just going to voice that now because we've already done components of that. Is that correct? Mm-hmm. All right. So the next thing we're going to start with, you go ahead.
The inspection.
Inspection?
The assess for orientation.
Okay, so assess, because there's 4 things. What are the 4 things? Person, place, time, event. So he's already told me person, okay? So do you know where you're at today?
Yes.
Would you like to see
In the exam room at Gardner Webb.
Okay, and about what time of day is it?
2:15.
All right, and he's already told me he was here for a neurological examination, so he knows the event and why he's here, okay? And you can technically ask him that and not divulge the information. So why are you here today? I'm here for a neurological examination, so he knows the event, okay? Next.
Assess general appearance, behavior, verbalize only.
So he is sitting here, so I've verbalized, I'm noticing his appearance. I don't see any gross neurological deficits. He seems to be looking at me. He's been following me and tracking me with his eyes. He has answered questions appropriately. So I don't see anything that would say, okay, there's an acute neurological emergency here. And so I feel like it's safe to proceed with the examination.
Inquires about patient's mood while observing affect. Verbalize.
So can you tell me how your mood has been here lately?
Been pretty good. We got
Pretty
a
good?
big test coming up.
Got a big test, so a little bit stressed out over that. Okay, so I would say that his mood does look pretty good as far as the affect that I'm seeing, not his mood. His affect looks pretty good. He's kind of smiling. You can tell that he's got a little bit of mild psychomotor agitation, just sitting here, maybe a little nervousness. And he did tell me earlier about his being a little stressed about his test, and so he has that going on. But overall, nothing like that I would be overly concerned about considering his situation being in PA school.
Assesses patient's speech for Candace and content.
All right. So here again, his speech rate has been good. His speech content, thought process, those types of things have been logical. So I don't see anything there. I can notice that he's articulating fine, which I will mention later on in the cranial nerves part of the section. But just talking to him, I don't see anything that would concern me there with slurred speech or anything like that.
Now we go on to inspection. Assesses gross overall neurological status.
So I mentioned that earlier. So that's where you'd basically be looking to make sure there's not any type of acute emergencies you worry about. He doesn't have drooping on one side. His face is not drooping. His lips not drooping. His eyes are not drooping. Anything like that. He seems to be sitting there. He has pretty good tone from what I can see, just sitting there upright. Like I said before, eye movement with me. He's been tracking me. He's been watching me. Smiling at times. Maintaining eye focus. So nothing concerning overall.
Moving on to cranial nerves, it says must verbalize cranial nerve number and name it is being tested for. And then first one is olfactory.
So cranial nerve 1, olfactory. So if I can I get you to close one nostril? Can I get you to breathe out real slowly? Okay, and the other side? All right, good. Don't have them blow too hard because there might something come out. So I want you to close one nostril. Close your eyes. Tell me what you smell when you smell this. I mean it. It isn't real strong, but it's supposed to be a minute. All right, look at this. Close the other nostril. You can't smell that either? I can smell that one doing this.
You got to cut off.
You've been sick recently.
Yes, I do have.
Okay. So he should be able to smell that. That wasn't a good example. But it should have been a mint and it should have been coffee that you smell. You can definitely smell the coffee. Alright, but you can use like dentin gum, spearmint, something like that. It usually does smell pretty good. So that was cranial nerve 1. Alright, cranial nerve 2, optic nerve. So this is where we do our visual acuity. Okay, has anybody got the visual acuity card? That's the only thing I didn't pull out. So visual acuity, remember to look at the bottom of the card, because depending on what your card says, it's going to be 14 inches versus 6 foot apart. Remember what I told you about the 6 foot? If you're 6 foot, take 2 big steps and then turn, and that should be appropriate. So I want to get you to read some lines on here. Can you cover your right eye for me? Read the smallest line you can from your left to your right.
LTFPH.
All right, so when you read, for real?
The smaller you said?
Oh, okay, I got you. I thought he was reading that here. Good. So 2020. Now here's the key. Look at it to make sure you see. Because a lot of times students will be like, "Okay, very good," and then just keep going. I have no clue what I'm saying. I thought it was being funny and read these 2 lines here. All right, cover your other eye and read from your opposite direction.
HPFTL.
So he's got 20/20 both eyes. Okay, and then read the smallest line you can from left to right with both eyes.
LTFPH.
Okay. Do you wear corrective lenses? Okay, so it would be uncorrected 20/20 OU. Okay, both eyes, and OD and OS. Okay, is how you would say it in medicine, but just left, right, and then both eyes together. So that's the optic nerve there. So there's a couple other things we need to do for optic nerve.
Red reflex.
Red reflex. So what you would do here with a fundoscope. I am just so unprepared today. I forgot about all this part. We usually already done this in ENT, Shamlin.
No blame.
Yeah. So basically, what you would do is you would get, and you would need to cut off the light for this, to be honest with you. And so, what I would do is turn this on, assuming that the battery's charged. For real?
No, I think it comes charged.
Yeah, it does come.
I put mine in and it turned on.
Yeah. What's beeping?
The door.
Take the door. I don't know
The
about
door
that one.
handle.
Mine put it out of the box.
It may not have batteries in it. So,
The battery's in the bottom. You
The
have to
battery's
screw it
in
all
the
way
box.
the bottom.
And yeah, it doesn't even have.
Yeah, it's not in there. That's why.
Yeah.
You gotta put it in. It's in the same little box.
That's
It's a long box.
all right. So, once the battery's in,
fresh equipment.
all right. So, what you're gonna do is you basically cut off the lights. We'll just cut this one room off so I can show you. You really need the light to be all the way off, the door just a little bit cracked. And so what you do is you want to get about 18 inches away. You want to stand at about a 15-degree angle. So this would be 0-degree angle. So I want to be just slightly off center. Everybody knows where Mike Tyson's tattoo is, right? On the side of his face. Now that sounds silly, but this will help you guys remember. Because you always got to be opposite hand. Because if you do same hand, and you go in, me and Zane are going to have an inappropriate communication. You laugh. Students do that all the time. We actually had a brochure come back on one of our students, and they took several pictures of him doing skills back here, and he was in the wrong position. And I said, please don't publish that picture. That you can publish the rest of it. So, Mike Tyson's tattoo, it is same hand to his same eye. So, left hand to left eye. Okay? And so what I want to do is get a red reflex. And so what I want to do is I just want to shine it right there of his eye. And I can see that the back of his retina is red right now. We don't want to have leukocoria, which is white. That could be a sign, especially in pediatric kids, of a retinoblastoma. And that's a really bad player. Okay? So, long story short, that's red reflex. Go ahead.
Optic disc, optic cup.
So what you do next with the lights off, because this is really hard to do with the lights on, is a key here that you guys are going to have a hard time with is you're going to tell Zane, look straight ahead at
Sorry.
yeah, that soap dispenser right there, Purell, okay? So I just want you to look and stay focused on that. Don't pay attention to my light. So what I do, if you guys will notice, my light will never move from his eye. Okay, you guys are going to look like you've got some type of tremor going on, but you just got to practice. Okay, so Mike Tyson tattoo, 15 degrees. He's looking straight ahead. Notice how my light never moves from the center of his eye. I get about 2 inches away and I can start to see his vessels. And now I look around and I try to kind of go a little bit right, a little bit left. I'm looking at the optic nerve, the disc to cup ratio. I'm looking at the vessels, make sure I don't see any AV nicking, making sure the disc is sharp, and so forth and so on. And right before I leave, I'm going to say, look into the light. He's going to look into the light while I'm in, and basically I'm trying to get a quick look at the fovea and the macula. Okay, you probably won't see nothing, guys. It's hard to see. Professor Shannon would probably agree with this wherever she's at. It's hard to see the fovea and the macula. Correct. So, but it is. It's really hard to see. So that's how you do it, guys. You're just going to have to practice. Okay? And we'll go around and we'll help you show you, since we're on time, how to get this set up for you to do that. Okay? Most of the times the students, we did the ENT in the past first, but we're doing it second this year, so it's a little bit different. Okay? But we'll show you how to get the light set up. For today, focus on everything else, and then when we come around to check on you, we'll talk to you about your fundoscope. All right? Next.
Was that the assesses fovea or macula?
Yeah.
Patient looks in the Okay. Optic nerve 2 and 3.
Okay, optic nerve 2 and 3. So what we're going to do now is we're basically looking at pupils to make sure that they are equal, round, and reactive to light. So basically, we want the light on. I'm looking at his pupils, telling him to look straight ahead. I can see that both pupils are round. They're the right side. They're not ultra constricted. They're not mid-dilated or big. They're the size they should be, okay? And so I'm just looking to make sure that first and foremost, right? And so then it probably wants me to do the reaction test.
It says accommodative reflex. I don't know.
Yeah, so what we're going to do is the light reflex. So what I'm going to do is look ahead. This is the swinging flashlight I told you. So if I swing here, his pupil should constrict. I'm going to swing back. So I was monitoring this pupil. As I go in this time, I'm going to look at the opposite pupil, but make sure the light's only flashing into this left eye. And then this pupil will constrict. As soon as I take the light away, it will dilate back just a little bit, okay? He's in a well-lit room, so if I really wanted this to really be accentuated, I could cut the light off, because what's his eyes going to do in the dark? It's going to dilate. So then when that light comes across, it's really going to constrict. Move the light back out, it will dilate back up. Okay, so if you have a hard time seeing it, or they're really small, kind of like Zane's are in a well-lit room, you can cut the light off and check it that way. But remember, check one eye, back, let the eye reset, and when I come in this time, I'm looking at this eye. And then we do the opposite. Here, out, here, now I'm looking at this eye. Does that make sense to everybody? All right.
Cranial nerve 3, 4, and 5.
So what I'm doing now is basically looking with the letter H, looking for the ocular motor movements. Remember, this should be smooth pursuit. So as he moves his eyes and follows my finger and keeps his head still, his eyes should track real smooth. There shouldn't be any jerking motions, okay? And you can go a little faster than this. I'm just showing you. We don't want to go way out here because look, he can't go any further. And his eyes might actually start twitching a little bit because he's trying to track it. You don't need to go but to that extreme right or left to where his eyes meet. Follow my finger all the way in. So this is where I'm looking for accommodation. So he is, pupils are constricting. He's also converging. He's converging. I'm watching his pupils come back out and they dilate back up as I bring the finger away. So constriction in needs to be slow and then back out. I'm also looking at convergence where the eyes look medially.
Cranial nerve 6.
Cranial nerve 5.
5.
5. Okay, so trigeminal nerve. So what we're going to do here is we're going to test. Let me get my whole bit to cut it off. And so what we're going to do here is we're going to break our stick. Watch. Just break it. Now I have kind of a sharp point. Okay. At least sharper than the dull point. All right. And so what I'm going to do is test him on his 3 regions. Remember the ophthalmic region, we have kind of the maxillary region, and the mandibular region. All right. So with that being said, close your eyes. I'm going to show you what this feels like on your arm. So that's sharp. This is dull. And this is going to be soft. You feel the difference? Okay, so tell me if it's sharp or dull.
Dull.
Keep your eyes closed. Don't listen to the crowd.
Sharp.
Very good.
Sharp.
Feel the same? Okay. And then you can, however pattern you wanna do it,
Soft. Soft.
feel the same?
Soft.
Okay, so that would be soft, this would be dull, this would be sharp, okay? And really you can do sharp and dull together, and then if you want to go back and say, okay, tell me when you feel this and where, and you can do this, 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 if you want to do soft individually. The biggest thing we want to do is make sure he can tell the difference between sharp and dull, and you can do soft by itself, okay? Does that make sense? Make sure you don't do a big raking motion to where you cross into the zones. It's just a little whisk with a cotton ball, okay, when you're doing soft. And remember, dull is just in and out, sharp is in and out. We don't want to do this. Okay, we're not dragging it. Especially when we do the sharp edge, we don't want to drag it. Okay, often students will drag that cotton tip.
Ask patient to clench teeth.
So clench down. Okay, try to push against my hand. Open your mouth, okay. And so he clenched down, he opened his mouth. We could do the corneal blink reflex where I would take a cotton wisp, make a little sharp thing. I'll show you on him because he don't mind. Do you, Zane? All right, so I would come in, don't do this, but here's what it would look like. Zane, look at And so you'd come in close like this. Zane's not doing it, but most people, when something gets closer, what's the first thing you're going to do? You're going to blink. Okay, so as you come in, get closer to cornea, you would blink. Okay? All right, but don't do that. This voice, I would take a cotton swab, come in and check the blink reflex. Next.
Ask patient to the mouth.
All right, so he opened against pterygoid muscle. He opened up against.
Verbalize would check corneal reflex.
Just did that. Would it be in the game, Brittany?
Cranial nerve 7.
So cranial nerve 7. So this is the facial nerve, so I can get you to close your eyes tight. Don't let me open them. Smile. Frown. Okay. All right. What else?
So you just did all 3 of those, all
Yep.
7.
Vestibular cochlear. 8. Close your eyes. Tell me which ear you hear something in.
Left. Right. Both.
I can do the whisper test. Close your left ear. Remember, close left ear. Say a 2-syllable word.
Popcorn. Bubblegum.
And then you can do the other ear. Okay, just make sure you whisper. Cranial nerves 9 and 10. Glossopharyngeal and vagus, right?
Mm-hmm.
So what we would need here, Professor Shamlin, is a tongue blade. And once we get our tongue blade, we would ask, go ahead and tell Zane, can you swallow for me? So make sure he can swallow. Should be with the EMT stuff right there. And so once he does that, I take a light, ask him to open his mouth, real big, tongue out, say ah. And with the light and the tongue blade, which we'll make sure you guys have, they're probably in the rooms, is we would actually look to make sure that uvula rises, okay? I would voice that I could do a gag reflex. I'm not going to do it, but voice a gag reflex. Anything else on that one? With speech?
No, it's accessory.
Okay. So accessory nerve, shrug shoulders, hold them there, push down, take your hand, push against my, good. So his accessory muscles intact.
Hypoglossal.
Hypoglossal or hypoglossal nerve. So just to show you guys from the other, I'd take a light, say ah, and like say uvula rise. Okay, you can keep this one for your use later. Ah, you're sleeping now. So hypoglossal. So basically, speak your tongue out. I notice that it's midline. It's not deviating right or left. All right, and so I noticed that he has been articulating fine during this time. And I also noticed for any type of fasciculations or twitching I didn't see, put your tongue in your cheek. Tongue in his cheek. Okay, to make sure he's got good motor movement there. So that's the end of the cranial nerves, correct, Brittany?
Mm-hmm. Now on to motor exam.
All right, motor exam, quickly. So, spit them out.
Inspects upper and lower extremities for bulk, looking for
Remember, we're looking for bulk and tone. Okay, so I'm going to do it at the same time. Really what you should do first is look for bulk. Let's just do that. Do I see anything that's wasting away? Okay, everything looks pretty symmetric. He's got good bulk. Okay, and so now for tone, I actually remember we all have a little bit of tone naturally. Remember we talked about that. We're not just flaccid, but we're also not rigid or spastic. And so we just want to make sure we move it through these motions. We come down here and make sure that we have good tone there, okay?
Muscle strength.
Right.
Major muscle groups bilaterally.
Starting with the shoulders. Name them out, I'll go through them. We'll do this quick.
Test shoulder,
Shoulder, be specific.
adduction.
Adduction. So abduction, hold them up. Tell them your myotomes, C5,
Deltoids,
that's your muscle group. Tell them your myotomes,
C5.
okay? So here, and then adductions to bring them together, okay? And then we're gonna come with elbow flexion, right, Brittany? Read them fast, Britt.
Test elbow flexion, C5, C6, biceps.
There you go. Next, Brittany.
Test wrist extension, C6, C7, extensor carpi radialis.
Okay, did you do tricep extension?
I just.
There was elbow
Did
extension that she said.
Elbow extension, okay, so you push down. All right, next we're on wrist flexion, Brittany.
There you go. C6, C7, extensor carpi radialis.
Okay, and then,
Test finger abduction, T1 abductor digiti.
okay, and then we're gonna do adduction.
It says test hand grip.
Okay, hand grip, you do 2 fingers and squeeze. Squeeze as hard as you want to, not gonna hurt you. All right,
Test opposition of thumb.
pinky, right there, good. All right,
Lower extremity.
all right, so finger adduction, abduction, I think we somehow missed that or whatever, or maybe I missed it, so don't forget that, okay? So lower extremities,
Test hip flexion.
okay, so pull your hip up. A couple ways you can do this. You can also have the patient standing, put a hand on the board and or on the bed, push up, push back, or you can have a leg back here and extension. It's hard to check extension with the patient here because he has limited movement, so I'm gonna stand him up. Put your hand on the bed. We'll just do unilateral so you guys can see it for sake of time. Hip flexion up, hold it there, don't let me push it down. Leg straight back, hold it there, don't let me push it down. So that's hip extension, hip flexion. Next.
Hip adduction.
Hip adduction, so what I want you to do is I want you to come across like this. And let me push it, right, good. You can also do that if the patient's sitting and just have them squeeze their legs together, squeeze their legs open, okay? Hip abduction, out. Okay, push down, sit down. Knee extension, knee flexion, is that correct?
Hip extension.
You just did that one,
Test knee extension.
okay? So knee extension be out, then let me push it down, okay? Flexion, push back, okay? Next.
Test plantar flexion or dorsiflexion. Foot flexion.
So what I do with my patients is ballerina toes, point to the floor, don't let me push up. Dorsiflex to the ceiling, don't let me push down. All right, squeeze your toes together, fan your toes out. Good, good. What else, Brittany?
Test extension of great toe.
So just lift your great toe up. Good. All right.
Light touch, sharp and dull.
So we'll do this over the body for sake of time.
Can I do one thing real quick?
Yes.
Okay, what I see a lot of students doing with motor is when they check, we're just gonna check like his hip flexion, so lift your leg up, and students will bounce on their leg. Don't bounce whenever you're checking for motor. Okay, hold it up, 1, 2, 3, and give enough resistance. And so for hip flexion, you want his knee bent. Pull your knee straight out. Okay, lift your leg up. This is not what you wanna do to check hip flexion. Has to be bent at the knee. Okay. Carry on. Don't bounce, you'll be counted wrong.
She's stronger than me. So, with sharp dull, same thing as you did your example a while ago. You can give them examples. So you're just going to do sharp, sharp, mix it up, dull, dull. Have them compare both sides. So you're going to do 2 at one time. So here, he feels it. He tells me where. Here, he feels it. He tells me where. Do they feel the same? Yes. You just go. So it tells you on the checklist to get a couple upper, T4 nipple line. You just voice that one. And then you got it's a T10, it's on the checklist. And then you start doing the thigh, medial calf, medial calf, medial calf, and then the foot on the outside. Okay?
Sensation, test upper and lower extremity.
And I did that quick with time. So sensation test upper and lower extremities, so that's what we just did. And then we go back and do soft touch. Tell me when you feel it and tell me where you feel it, okay?
Discriminative sensations. Test stare.
So stare, nausea, close your eyes. I'm gonna put something in your hand. I want you to tell me what it is. One hand.
Feel like a tape measure.
Good. Leave your eyes closed. Good. So you did that. Then graphesthesia, right, Brittany?
She's pointed out that I may have missed one with the sensation.
The joint vibration.
I don't know, you're going fast, I'm trying to watch.
So joint vibration. So what we do here is we do joint positional sense, we do joint vibration. Remember, hold by stem, 128, 256 is acceptable. So what I'm gonna do is put this on your hand. I just want you to tell me when it quits vibrating, okay? Notice I didn't hit it hard. Can you feel it? Tell me when it goes away. See, I barely hit it. He still feels it. I feel it too. Now, okay, he could have lied. That would have been fine. But no, that was right, okay? So do the same way here. Remember, distal interphalangeal joint, your fingers under, and then toe, under, toe, under. So we check one phalanx on each upper and lower extremity. And then positional sense, that's where you want to get the DIP joint. Hold it on the sides. Close your eyes. I'm going to show you. This would be up. This would be down. And here it is okay to wiggle. So you just kind of, and so you push in the down position, up position while stabilizing that joint. You do both fingers, and then you do the toe as well. Up, up, down. Just mix it up. Don't do the same thing every time so there's not a pattern. So next.
You didn't do the stereogenesis, right?
Yeah, I've already done that.
Okay, now it's
Graphesthesia,
Yeah.
stereognosia. So stereognosia was where I put the key in his hand. The graphesthesia is going to be where I draw something in his hand. I can just do it with my finger. I was going to do it with my key. I'm going to draw the number facing you. Tell me what number it is. Good. I'm going to draw a letter facing you. Tell me what letter it is.
A.
Good.
test point localization and extension.
All right, so I want you to tell me if I'm touching you on one side of your body or two sides of your body, and where. Close your eyes.
On my shoulders. One on the left elbow. Top of my hand, both of them. Left knee. Right mid thigh. Lateral calf on both sides. Top of my left foot.
Come like so. All right, that was point localization and extinction, because he could tell me where, and he could tell me one or two sides.
2-point discrimination.
So remember, like I showed you in class, close your eyes. Tell me if I'm touching you with 1 point or 2 points.
One. Two.
See the difference? And when you get to the finger, you want to do forearm and do finger. When you get finger, close your eyes.
Two. One.
Good deal.
Bicep reflex.
Professor Shemlin?
I didn't hear what you said.
Reflex, Hammer. Who's got the reflex? All right, he's got his.
I didn't say anything.
Here's one, Richard has one.
All right, here we go. So find a tendon first. Tell him to relax. Relax as much as you can. Oops. And so this is the hardest one to get. Relax, close your eyes. So you may be able to get it listed, you may not. I could get that one. The biggest thing with your reflex hammer I try to teach students is try to be as pendulum-like as you can. Meaning, don't be like a woodpecker, okay? Let it just kind of flip, okay? I got that one. So triceps, relax. All the way, relax, close your eyes. All right, that one Alyssa did. Close your eyes. Relax your shoulder. Let me have it. Your arm's dead. Good. Brachioradialis. I'm not going to kill his bone here, but all right, we'll try this one. You just practice a little bit. You'll find where it is. I'm all over it, but it's not really.
What are you looking for when you're doing that?
His hand will actually jerk, kind of, yeah. He'll have a little movement with his hand. Knees, uncross your legs, close your eyes. This one's pretty easy. Find the patella tendon. right there. Okay, and remember, dorsiflexion, don't use dorsiflexion, just let me have your foot, it's dead. It'll make the Achilles a little bit more prominent. You see there, he pats down. Pats down, everybody see that? If you just do like this, it's much harder. But if you lift up just a tad, see that? Keep playing the drums. Alright, Babinski, take the sharp point, take it, and rub your foot across like this. You see he's not doing much, sometimes they won't do much. But it should not fan out, it should flex, okay? Remember, you're rubbing from inside, back around to the ball of the foot toward the great toe. So that's Babinski. What else?
Test point to point, finger to nose.
All right, put your finger on your nose. You want this to be complete extension, everybody. Touch my finger, put it back on your nose. You can look at the target.
Oh, okay.
I didn't say switch hands.
I got short hands.
All right, switch hands. Somebody said they'd done this actually before.
I did it also.
All right, here we go. So, finger to nose. Heel to shin.
Rapid alternating movements of hands.
All right, take your hands, put them in your laps, and do like this. Take your feet and tap them against my hand. And then rapid alternating or rapid finger movements like this. Wiggle your toes. Good. Rub your shin down your front. No, front. Heel down your shin. Good. All right, good. Sorry.
Was that the test stance or no?
All right, stand up. All right, so I want to look at the stance. So some things you want to check in your stance. Even the upperclassmen didn't do this. Please do this. Look at hips. Is the hip symmetric? You can feel where the ASIS is. You can actually feel the PSIS. Look and make sure the hips are symmetric. Look at the person's stance when it comes to, are they flat-footed or not? What's their foot look like? Is it pronated? Is it supinated? Do they have a neutral stance? Do they have an arch? Do they have basically flat feet? All right, and so you look at all that stuff, make sure that they're level before we start to have them walk. Okay, I'm gonna have you back up just a little bit. Notice I got his arm. So let's just do a regular walk over to Taylor. Like you're just walking with your friends down the hall. All right, so I'm watching his stride, I'm watching his strikes, so the heel strikes first, then the toe. So I'm making sure that all that is normal. Next we're gonna do tandem, don't do it, just watch me. We're gonna do tandem gait, one foot in front of the other. Okay? Notice my hands behind him in case he falls, I can grab him. All right, stop, walk on your tiptoes. All right, turn around and walk on your heels. All right, good. All right, that's it. Do you have any questions? Do you have any questions?
No.
All right, good. Sit down. All right, any questions, anybody?
Did you do the Gendrastic maneuver?
Gendrastic maneuver, you can do that, sit down. And so, if you can't elicit a response with his Achilles, then what you can do is have him grab his hands like this, pull real tight like you're going to flex and make a muscle. Let me feel your muscles. All right, close your eyes, flex, flex. Uncross your legs. There you go. And then what you would do is, and you'll be able to get that to elicit, should. I can't see where I'm at. There you go. All right. Anything else? Good.